Okay, good evening, everyone. I hope you are all doing well. Happy Friday to everyone as well. Thank God it's Friday today. So the week has reached its end. Tomorrow is Saturday. We have the weekend to spend with families. If you are going to work, I'm sorry, but you can also have a bit of time for us when you are at work, or you can catch us on a replay maybe tomorrow or in the next days. So as you can see, I'm your favorite host. I'm back again, Stefania here. I'm here with my favorite nurse. She's a professional nurse and her name is Coach Angie. And we are here again to bring another topic on board. So we are going to discuss about it, and we are having an English session tonight. So if you're watching us on Facebook or on YouTube and you want to ask any questions, you can write it in the comment section and we will be glad to give you an answer. And if you're watching us live on Zoom, you can also unmute yourself when it's time to ask questions, and then you can ask your question. If you feel more comfortable with the Twi language, you can also ask it in Twi language, okay? So the topic for today is child's health. We are about to talk about the health of our children, how to take care of their health from pregnancy, from the very beginning of how a baby is formed till when the baby comes to this world. So I'll give the floor to Sister Angie, so she will start giving us an introduction of today's topic. And as we carry on, I will keep an eye also on Facebook, the comment section. So if any question is coming or anything is coming, I'll read it so that we all know what is going on. And when you see this video, please share it onto your page so that other people can also listen to what we are saying, because we are educating ourselves in various topics. We are treating various topics because we know that we need more knowledge. Okay, so keep sharing the video for us on Facebook, on Instagram, on YouTube, everywhere you see this video, keep sharing. Thank you so much. Stanji, please, we can start for tonight.
Okay, thank you so much, Stefania, for the introduction. And good evening once again to everyone watching us on all the platforms, Facebook, YouTube, wherever you get this video. My name is Angela Asari, as Stefania said, and tonight is for the kids. We've been treating topics for adults for the past 2-3 months, and tonight we decided to go for the kids because we know kids are very delicate and they are the future of our world. So at times we tend to take our eyes off their health, but they also need our help as adults so that they will be able to be healthy. And when they are healthy, they are happy kids. And we, the parents, we are also happy mothers and fathers. So tonight we are dedicating it to our young ones, the future of the world. So Stefania, can I continue?
Yes, please, we can start. Thank you.
Okay. So there are lots of things that the kids go through from in utero. That is when they are developing in the uterus till they come out. They go through a lot of things. Some of the things they as kids cannot do anything about it, but we as adults can do something about it to help avoid all those things. So we are starting from there because every child is being formed in the uterus before they come out as babies, and then they will be growing up as the days go by. So we are going to start from in utero. That is when they are developing in the uterus. When kids are being, when a man and a woman meet, the man brings a sperm and then the woman brings an egg. The sperm and the egg meet together to form an embryo, and then the embryo develops into a fetus. Then the fetus is what comes out as the baby. So during those stages, it's a 9-month journey. So from the time that the egg and then the sperm meet, there's multiplication of cells that goes on to form the baby. So during those multiplication of cells, that is when a lot of organs are being formed. the heart, the limbs, that's the leg, and then the hands, the eyes, the mouth, and all that, they are being formed during those times. So if there is any breach in there, there can be a deformity, which the child knows nothing about it, and you give birth and you see that your child is having maybe a short limb or without an eye. At times we have twins who are being formed together and all that. So some of these things we can avoid them. And what we can do to avoid something, especially during formation of a fetus in utero, is you, the mother, you have to attend to antenatal clinic as early as possible. You need to attend as early as possible so that if there's anything developing, your midwife or your gynecologist or obstetrician will notice it, and if there's something that they can do about it to help the baby, they will do it quickly. If there's nothing that they can do, then they will advise you on what to do so that after the baby comes to the world, then you bring the baby as early as possible so that something can be done about it to prevent a long-term deformity. Sorry, guys.
Yeah, so while we are having the discussion and you have any questions, feel free to raise your hand. So as I was saying, if you're watching us live on Zoom, you can click on more, and then you see a hand that is raised. So you can click on it. I have my eyes on the app, so I'll be able to see that you raised your hand, and then I'll give you the chance to ask your question. Okay, we are back.
Okay, thank you. My kid was disturbing me.
No worry.
Okay, so what I was saying, to continue with what I was saying, if something is being detected during that stage, something can be done about it. So you need to go for your first antenatal appointment very early. Some people wait as late as 8 weeks or 10 weeks. That is when they will be going for their first appointment. The moment you do your rapid test and you see that you are pregnant, then you need to rush to the hospital so that you can book an appointment and then find a midwife or an obstetrician so that they will book an antenatal appointment for you to start as early, because the first day that you go, a lot of tests will be run, your blood test, urine test, and then a scan will be taken as well. So if at times there might be an ectopic developing, but because you didn't go earlier, by the time that they detect it, maybe the embryo would have grown bigger and it can even rupture. And when that rupture, it can bring a whole lot of havoc. So you need to visit your midwife or your obstetrician as early as possible. And what you can also do to help the baby that is developing in utero is to take your routine medication. We know that when you are pregnant, you are normally given folic acid, fesolate, and some few other medications to be taken, which helps with the developing baby. So if you don't take all those medications, it can lead to something else. There can be a deformity when you don't take your folic acid, and meanwhile too, you are not eating well, you are not taking any supplements, you are not doing anything to support your nutrition. If that happens, it affects the baby in utero, because the moment the baby starts developing in your uterus, it takes nutrients from you, the mother, because the baby cannot come and eat fruits and vegetables from outside. So the only way that the baby can get all those nutrients is from you, the mother. So you need to take enough so that the baby too can get enough and feed on through the placenta and then the umbilical cord. That transfer helps the baby to get the nutrients. So you need to be taking sorry guys.
That's how they are. When they see that you're doing something that you're
concentrated. I don't know if it's because we are talking about children. That's why she just wants to distract me. Sorry. Okay. But
I
I
will
don't
see my baby.
because I'm talking about children, so she decided
That's
to
why.
that's okay. So taking those routine medications to help a lot to get all those benefits from your folic acid and then the fesolate as well. And that also prevents a lot of malformation in utero as well. And the next thing that you can do as a mother who is growing a baby inside you, you need to eat very healthy. You need to get enough vitamins from the foods that you eat. At times, we all know how hectic pregnancy can be. Some people, when they are pregnant, they cannot even eat. But then you need to try your best, even if you are vomiting frequently, you need to try your best and get the best foods that will help you get all those nutrients. Even if you eat very little, it's better than none. If you eat just a little fruits and vegetables, at least you get something for the baby to feed on. If even you, the mother, you don't get the benefit from it and the baby gets it, I think it's better because the baby is now developing. So if it doesn't get all those needed vitamins and then there is a malformity, the baby is going to suffer for the rest of his or her life. So you need to sacrifice for that baby and get at least something small. Don't eat junk food. At times you feel like eating certain foods, but then think about the baby and get the right nutrients as little as you can so that it helps the baby. Okay, so that is it for um, the baby in utero. And then even after birth, after childbirth, after or during childbirth too, some things can happen for the baby to get deformation. Especially, there are some people when they are being asked that they should go for cesarean section, maybe it could be that the baby has a bigger head than the passage of you, the mother, where the baby's head is supposed to pass. Maybe yours is smaller and your baby's head is much bigger. So you need to have a CS, but then they will insist and they will tell the doctors that it's patient's right. So if a patient tells you that I'm not going for the surgery, you, the doctor, cannot force the patient. If only the patient is above 18, if the person is below 18, then a decision can be taken for that person. But if the person is above 18, there's nothing that you can do. The person says, I'm not doing it, you cannot do anything about it. So at times we are being given medical advice or surgical advice, and because we don't want that thing or because of something that we've heard about that particular thing. So we decide not to do it, not thinking about the complications that you not doing it can bring to the baby which is coming to the world. So if that baby has bigger head compared to your passage area and you are being asked to go for cesarean section and then you insist that you are not going to do it, then that means they have to force the baby out, and that can the baby can be stuck there for some minutes or even hours, and if you are not lucky you will lose your baby. If you are lucky to, they will try their best using vacuum and other measures to bring the baby out, and the baby can get problem with the brain and then other parts of the body. Some even get fracture because of the force that the midwife or the gynecologist would try to bring them out, and some of them get fracture of the limbs and other areas or bruises on their face, which can leave them scars and other things. So you as the mother, you need to think about your baby. Don't think about yourself alone. Any woman who is on the delivery bed or who is pregnant, the first thing that you have to think of is your baby. Don't be selfish. Think about I'm not saying don't think about yourself. Think about yourself and then the baby in there. You can do something to help yourself, but the baby in there can never do anything to help itself unless you, the mother, helps that baby. So we need to take consideration of all those things when we are being advised on something, especially during the time of delivery and other things. So these are some of the things that can bring problems to a baby during pregnancy and then during delivery. These are some of the things that can bring health problems to our babies. And some babies too can get infection during when they are developing in the uterus, or even at birth, they can get infections, and that could be from you, the mother. So you need to try your possible best to stick to all the hygienic measures so that you, the mother, you keep the area where the baby is going to pass out very clean so that there wouldn't be any traces of infection while the baby is coming, so that the baby can pass through a clean and healthy, hygienic passage to the world. Okay.
That's very true.
And another thing that can bring health issues to our children too is during development. When they are developing after birth, they need to develop because they move from stages, from the neonatal stage to baby to a toddler, and then it will be going up and down till they get to adolescenthood and other things. So while they are developing too, they can also get a problem during that stage. So you as a mom or a dad, you need to monitor your child when they are developing, so that if you see any slight thing which is a little bit abnormal, then you need to take the child to the hospital so that proper checkups can be done to prevent that thing. At times, we see certain things on our baby. There are some people who have children who have delayed speech and other things, and they, instead of them taking them to professionals who can help them with a lot of therapies to get them out of it, they will try and then hide those kids in the house. Instead of them taking them to the hospital, they will hide them, and then the kids will be there. By the time they grow up, because they didn't get any therapy, then things will get off hand and nothing can be done about it when they get to a certain stage in their life, because we have the developmental ladder. So if the person passes the ladder, like maybe there is a development which is supposed to happen from 0 to 3 years, it could be delayed to, like, say 5 years, but then within the after 3 years to 5 years, if you take the child to the hospital to see a specialist, they can do some therapy to help the child so that within that 2 years the child can start picking up. But if you try to tell yourself that I refuse it in Jesus' name, I know God is there, but then God has given knowledge to other people who have a lot of skills. We have to help our children, but then because especially we Africans, we are too I don't know the words, I don't want to offend anyone, like we are more holy. Let me use that word, holy. Like I don't say you shouldn't pray. You can pray for your child, but then God even say, the Bible says, God helps those who help themselves. So if you help yourself and then you pray to God, then things will move on very faster rather than staying there for a development which is supposed to occur from 0 to 3, and then you wait till the child is, like, say 10 years. That is when you are going to seek for help. By that time, it will be too late. And when you take the child, nothing can be done about it, and you would have destroyed the child's life. Maybe the child didn't know that it was because of your ignorance or because you didn't want to take him or her. That is why he ended up like that. So we as adults, we as parents, we need to monitor our kids during their development. If even you don't know the things that your child is supposed to do, we have from birth to 0 to 3 years. Like we have a lot. So you can even, right now, when you go to Google and you type anything, Google is going to give you a lot of information. So maybe when you give birth and you want to know the developmental stages that your child is supposed to go through, you can just go to Google. If your child is 1 month, you can type developmental milestone for, like, let's say 1 month old baby. See that it will give you the information. Then you read through. After reading through, then you start monitoring your child, so that if you see that there is something going wrong, then you quickly take the child to seek for help rather than waiting for it to be too late. So during the developmental milestone stage, we need to be very vigilant so that we detect certain abnormalities that can become a long-term problem for our children. So we need to take care of all those things. And another thing that can bring health problems to children when they are developing too is home accidents. A lot of kids become deformed when, like, from, let's say, from age 3, from 2 years onward, because by 2 years the child will be walking. And when they start walking, and if you don't take good care of them, like if you don't watch them so closely, they can have a home accident that can cause a permanent deformity for the child or a permanent health issue for the child. So you need to watch out for all those things. Try as much as possible to take away a lot of things that can bring home accidents, like wet floors, and then if you have glasses and other things which are not being placed at, you have to place all those things like sharps and glasses and all those things. You need to keep them at places where the child cannot reach them. But if you ignore and then put them at places where that 2-year-old boy or girl or 3 years old boy or girl can reach it, it can cause a problem in your home. So we need to try as much as possible. There are accidents that happen that it might not be your fault. It might not be your fault, but there are some too. If you will sit down and you know that this thing, it was my own mistake. And when that happens, like, you feel so bad. You feel so bad for the rest of your life, especially when the child gets a permanent deformity through that accident. And you yourself, as a mom or dad, you know that you placed something there or you didn't do something. That is why that accident came about. But if an accident happened and it's not your fault, that one, you cannot do anything about it. But the things that we can avoid, we need to do our possible best to avoid such accidents in our home. And another thing too that can bring health problems, this one is a bigger part, because this one, that time when the child reaches that age, it's your duty as a mom or dad to provide your child with good nutrition. So if you ignore that and you don't check the nutrition of your kid, your child can be malnourished or overnourished, and that can also bring problems to your child as well, because there are nutrients that helps with their bone development. It gives them strong bone and all that. So if you don't give them all those nutrients in their diet, they are going to lack those nutrients, and it can bring health issues to them. There are nutrients that help them get a lot of blood to prevent anemia, because some kids are prone to getting anemia if you don't feed them well. If you don't feed them well to get enough of iron, folic acid, and all that in their food, they are prone to becoming anemic. And when they become anemic, because they are children, you can lose them easily. When they become severe anemic, you can lose your child. So we need to try and then feed our kids well. Try and then give them balanced meal. As kids, they need all the nutrients. Unlike we adults who have to try and then limit our intake of carbohydrates and then certain fatty foods and all that. The kids, they are now growing. they are now growing, so they need a lot of carbohydrate for more energy. They need a bit of fat for them to build their tissues. They need proteins. They need vitamins. They need minerals. They need a lot of things in their body, things they are now growing. So it's your duty as a mom. I know moms, we cook, but at times there are some fathers who also cook for their kids. So we as moms and dads, we need to try our best to watch what we are giving to our kids. Make sure that when you are serving your kids with their breakfast, dinner, or lunch, you have to make sure that you have a balanced meal that you are giving to them so that they get a bit of all the nutrients to aid in proper growth. Because if they lack every nutrient that we take, if you lack it, it has a problem that it can give you. Lack of every nutrient comes with a condition. So in order to prevent all those conditions, we need to try our possible best to try and then give them balanced diet. Let them eat more of the fruits and vegetables. I know some kids hate eating fruits and vegetables, but the little that they can eat, you can find a very good supplement and then top it up for them so that they get enough in their system in order to prevent all those abnormalities that lack of nutrients and nutrients can cause in their lives. And another thing that the kids suffer from is mental problems. Mental problems, and at times it's the fault of some of the parents that bring mental problems to their kids. The way we treat them, the way we talk to them, and even the behavior of you, the mother and the father in the house. Because as kids, when they are growing up, they watch and listen a lot. So any action that you, the mother or father, puts up in the house, they wouldn't talk. Maybe at that time they wouldn't know how to speak very properly, so they wouldn't say anything. But then they are watching it, and when they watch anything that they watch, it stays in their brain. It doesn't go off, unlike we adults, because as adults we have so much in our brains, so we tend to forget things so easily. But kids, they don't forget things so easily. And when they catch that, when they capture something there, it's very hard for you to take it off. So we need to watch the kind of words we use on them, and then the kind of words that we use on our partners as well. So if you're a father, try not to use abusive words in front of your kids to your partner. If you're a wife, to try not to use abusive words or certain words that the kids are not supposed to hear in front of them, because when they hear it, it stays in here and it can affect them for the rest of their life. So we need to mentally, we need to try our possible best to do things that the kids are not going to suffer from for the rest of their life. There are some kids, I know some mothers, like they tend to use something to scare their kids, and that thing can cause panic attacks. They will tell you, oh yeah, me the way bet show, sorry, I'm saying it in G, like with the way bet show, like you are putting fear in the child, and it can lead to panic attacks. It can lead to panic attacks or anxiety attacks. And some kids do even suffer from post-traumatic stress as early as 5 years, 6 years. Then they are having post-traumatic stress because of something that they've gone through in the house, and because they wouldn't be able to voice it out. So as parents, we need to be very careful when dealing with our kids' mental health as well. And we need to monitor the kids as well, so that if we see anything abnormal, then we rush to the hospital so that a specialist can see them and help them at an early stage, rather than waiting for it to become worse. Because the more that they grow, the more difficult it is for you to get rid of certain mental issues. So when you detect it earlier, then a lot of therapies will be done so that the child can come out of that. And another thing too is cancers. Nowadays, we have a lot of pediatric cancers. A lot of children are suffering from cancers. I remember when I was in Ghana, I visited one of my colleagues. She was working at Konfanoti Teaching Hospital, and she was in the kids ward where they care for the cancer patients, only kids. And I was shocked when I went to the ward. Like, I thought some kids get cancer, but then I didn't know it was that much. But when I went to the ward, I saw so many kids, and I asked her, so all these kids are having cancer? And she said yes. So I thought cancer was like, when I was growing up, I knew there are adults who have cancer and all that. So I thought for kids it's very real, but then it's not real. A lot of kids are suffering from cancer. So we need to protect our kids. And the only way that we can help them is to give them more fruit and vegetables so that they get more antioxidants to protect their cells. If they get more antioxidants to protect their cells, then the likelihood for their cells to develop cancer is very low. So we need to feed us. It all comes back to nutrition, but then cancer is something broad. That is why I separated it from the nutrition. So we need the fruit and vegetables. Giving them the balanced diet is very important, but try to incorporate more fruits and vegetables in their meal. You can use fruit and vegetables as snacks for them a lot. Instead of giving them all those sweets and other things, we can give them more fruits and vegetables to use as snacks, and getting them is going to help them get a lot of antioxidants to protect their cells in order to save them from getting the cancers. I'm not saying if you eat fruit and vegetables, you can't get cancer. You can get it, but the probability of you developing cancer is very low. Your chance of developing cancer is low if you eat more of your fruits and vegetables to get a lot of antioxidants to support your cells. So let's try our best to pick something out of what we have learned tonight. I know I've talked much, but then I don't want to take much of your time, but I know the little that I've said tonight, we have picked something from it. If you can go and watch the video over and over again so that you pick a lot of things from the information that I've just given to help our kids, because they are the future of our world. If they develop any problem from now, by the time they grow up, they wouldn't be able to take our world to the next level. So we need to take care of them now to prevent a lot of problems that can affect their health, so that they can take over the world. When you and I are no more in the world, they can also take over the world, and then the world will be a better place. So thank you to everyone for watching. If you have any question, you can write it on any platform that you watch the video. You can type your comments or questions there, and we will come back and answer you. So God bless each and every one of you. Thank you, Stephania.
Oh yes, thank you too. Thank you too. You know what? I took some notes down while you were talking. So one thing I wanted to bring our attention on is when we were talking about the developmental ages and the stages of the kids. So when the kids go to school, here in Italy, for instance, kids can go to school from 3 months to 3 years. And then from 3 years to 6 years, they have their second stage. Then they have from 6 years up and above. So when the kids go to school and they have the teachers who spend more hours with them, at least the teachers will notice certain behaviors of the kids. So normally they can confront the parents and talk to them and maybe tell them that, okay, your child is behaving this way in school. Maybe when he's playing with the other kids or she's playing with the other kids, maybe she's beating them, he's beating them, he's being aggressive, or certain behaviors can be detected by the teachers as well. Or maybe some mistakes they do, if they are not able to correct them, they tell the parents so that the parents will also notice, they will also study the kids at home and see what they are saying, if it's true or not. Because I think that some kids can behave differently in school and also at home. Some of them are very good actors. Some of them are very good actors, but some of them, I think we have to consider what the teachers are saying, because when you start studying your child also at home and you start remembering what the teacher told you after school, and you see that what the teacher was saying is right, I think you have to start thinking about the next step. Maybe you can start asking the teacher what you can do to change that behavior. And you can start Google it if you want, or maybe you can ask your doctor, the how do you call it in English? Pediatra.
The family doctor.
The family doctor of your child. You can ask him or her what you can do to help your child to improve in this, and definitely he or she, the doctor, will lead you to where you can be followed, especially by a specialist, because there are a lot of specialists, as Sister Angela was saying, that can follow the kids from tender age until maybe in all their stages. And then one other thing you were saying was about when maybe the child is starting to walk and they find about domestic incidents. So maybe they find dangerous objects in the house, maybe scissors, or they find maybe a color, maybe this part of the color is very dangerous because they can put it in their mouth and it can choke them. So a lot of objects in the house, when we have a look at them and then we ignore it, that is exactly what the kid is going to take and put in their mouth. So that is very, very dangerous, and that is something we have to be very, very careful about, because kids can do a lot of things. They can amaze us because they are learning. They are also learning. They are exploring the world. So everything is new to them. So they want to try everything. But we are the ones who have to guide them and help them to explore in the right way. Yeah. So then you talked about diet as well. One problem I had with my first daughter's family doctor is that she was always complaining about my daughter was too big, because she was born big, so she was growing above her standards, So she was always recommending to give her more fruits and vegetables. So, there are certain times you start thinking, oh, this woman is disturbing me. This woman is disturbing me. She always wants to be on my neck. But on the long run, it's true, because when they start school, they start moving, they start playing around with kids. So they will eventually try also different kinds of foods also at school. They'll start exploring new vegetables, new fruits. And when they see other kids eating those kind of fruits, it will ring a bell in their head as well. So they'll start changing, their body will start changing. So everything starts at home. So when we at home start to give them the right nutrients, then when they go to school, they know more or less what it's about, and they can try what is in the school as well. And then when they come back home, they can ask for that kind of vegetables or fruit. They can mention the name so that you can hear it and you can go and buy it and prepare it for them and see if they will eat. And if they will eat, it's good. It's good. So everything is very important, and everything starts at home. Everything starts at home. Also for the bad words, when you're telling them to shut up, the way you will tell them to shut up, that is a major problem, because they will learn it. And when you go outside, they will say it. That is what they will, and that is what is going to disgrace you outside, because definitely they heard it from someone. Someone told them that word. So that is something we have to be very, very careful. So I think I don't have any raised hand, but if you are live on Zoom, you can unmute yourself. And if you have any questions, you can ask. If you are on Facebook as well and you have any questions, I have Sister Gina who is saying good evening to you all, and Sister Pierre Paul who is saying hi. Yes, so we have people who are watching on Facebook. So if you are on Zoom and you want to say something, either contribution or question, you can unmute yourself. You can just click on the microphone. The red will disappear, and then you'll be able to ask your question. So you are allowed to unmute yourself if you have any questions. Okay, it's 9:46. So if there is nothing, maybe you want to tell us backdoor, because maybe you want us to know something, maybe backdoor, you can send us a message. You can come to our inbox and you can tell us. So maybe next time when we bring another topic, we can refresh about this one a little bit. If you have any topic you would like us to discuss, please feel free to tell us anything about our health. One thing I heard from a lady in here in Italy is joints pain and also the knee pain. So one day we'll definitely treat this topic as well, because it's very important for our mothers, our fathers who are suffering from maybe arthritis, joint pain, and so on. So we will definitely take one day or maybe more sessions if it's a broad topic to discuss about these issues. Yeah. So I think we are done for tonight. Thank you all for watching us tonight. If you're watching this video on a replay, please listen to it very well. If you have any question, feel free to come to our inbox, and please feel free to share this video, and so that other people can also get in touch with us and learn more about kids' health as well. Thank you so much, Facebook. We are going off from Facebook. Sister Angela, thank you so much for sharing all this information with us. You're always lovely. And we pray that God will give you all your heart desires, because as a professional nurse, I pray that God will open new doors for you, because you really deserve it. So bye-bye, Facebook. We are done with you. Okay.